Alcohol. What's the first idea that comes to your mind when I say the word? Probably, maybe, it's probably something negative. Something that damages your health, your liver, your brain, or maybe it doesn't even apply to you at all. Maybe you don't care about alcohol since maybe you're not a drinker. That's why I'm here today. I'm here to show you that actually abstaining from alcohol consumption can actually threaten your health. It does so in many ways. According to studies, it actually can lower death rates in brain injury patients. Not consumption, I mean drinking it. But obviously it has to be in moderation. If you go overboard, we all know that it actually is not beneficial. According to a report in the September issue of the Archives of Surgery, there had been a study of 38,000 people with brain injuries, and it showed that 9.7% of those with no trace of alcohol in the bloodstream died in the hospital compared to a 7.7 death rate for those tests that showed the presence of alcohol. Also, at the University of Toronto, Dr. Homer C.N.T.N., who is an assistant professor of surgery, also said that alcohol has to be handled carefully in medicine and real life. The report was very careful to say that alcohol has a huge potential to destroy life, but from a public point of view, it is not something we should mess with. Ethanol may have pharmacological role if administered in discrete amounts in certain circumstances. According to the studies, we can see that we have to be really cautious about this, but obviously if more research is done, it can be possible. Also, if taken in moderation, alcohol can also lower death rate in heart diseases. Health professionals follow a study led by Dr. Kenneth J. McConnell, who is an associate in medicine at the Beth Israel Technical Medical Center in Boston. It showed that eight men among the 1,282 who drank about 2 drinks a day had heart attacks. 9 among the 714 who had over 2 drinks a day also had heart attacks, and 28 among 1,889 men who did not drink at all had heart attacks. So from the numbers, you can see that people who did not drink actually had a higher risk of getting heart disease or heart attacks than the ones who drank in moderation. Also, according to the U.S. National Institutes of Health, it's actually recommended that you drink one drink per day for women and two to 3 drinks for men. And a drink is maybe a 12-ounce can of beer or a 4-ounce glass of table wine. Also, and in this book that I read called The Mediterranean Heart Diet, written by Helen V. Fisher with Cynthia Thompson with a PhD, it said that red wine has benefits. It is cardioprotective, which means that it inhibits cells in blood from clogging arteries by activating the blood's natural anti-clotting enzyme, and it also has anti-tumor capacity. So red wine, red wine is actually good for you. And also, according to another study, it is proved that non-drinkers are actually more likely to be anxious and depressed than the ones who drink moderately. The professor in the Norwegian University of Science and Technology's Neuroscience Department, Dr. Einstein, not Einstein, Dordal, he says that we see that the group that doesn't drink is less socially well adjusted than the groups who do, and generally when people are with friends, it is more acceptable in Western societies to drink than not to drink at all. So this leads to connection with others, and obviously people who don't drink have fewer friends, so that's another reason why they feel more depressed. And my last supporting claim is that wine may actually shield breast cancer patients from radiation side effects. According to a news release from the American Society for Radiation Oncology, it's suggested that skin reactions are a common side effect of cancer radiation therapy, and while medications can actually prevent these problems, they can be expensive, and often have their own side effects. In some cases, drugs used to reduce radiation-linked side effects can actually protect breast cancer tumor cells. So this is where alcohol comes in, and studies have shown that alcohol actually can prevent these side effects, but also note that it avoids the side effects, but it does not avoid the breast cancer itself. So people with who are in potential danger for breast cancer should not drink alcohol. And so basically that's my claim.
All right. I thought that you did a pretty good job stating what the proposition was. The rhetorical question at the end is okay. You do want to highlight that that is the proposition a little bit more. You start to preview the material, but then you just dive right into that first point, and I think you want to set up the structure, what the 4 supporting points are going to be at the beginning of the presentation. I thought that's what you were doing, and then it just turns out that you'd actually started that first point. I think you need to do a little bit more about why this is controversial. Are there people who dispute these results, or, for instance, is it tough for people to decide whether or not they fit in the category of people who would benefit from drinking or the people who would suffer from deciding to drink? I thought that the signposting as you went through the speech was pretty clear. Although the secondary points are not always stated as claims, they are usually distinct. I think you do want to use some numerical signposts for the oral presentation to help the audience listen. I thought you did a good job trying to explain that on almost all of the points that this is about moderate drinking, not downing a 6-pack every night to protect your heart. You had some good information that you report. Statistics were in the studies that you cited, but outside of that there wasn't a lot of statistical information, but you were pretty consistent about citing authorities and the researchers and the conclusions that they were presenting, and I thought you did a good job on that. I do think you're a little quick sometimes in making the causal connection that it's the alcohol consumption as opposed to some other factor, and it might be something that the doctors have written about in the articles that you could quote that would strengthen that argument, because there could be a lot of other explanations for these kinds of things. Like it might be a little bit circular to define people as having fewer relationships because they don't drink, because when you drink, everybody's your friend, and maybe they aren't real friends. It's just one of those kinds of circular sorts of definitions. Okay, thank you.